thank you for the second half of today's event at Allen County Public Library. As reintroduction, I'm Rick White, co-founder of Vivid-Pix, CEO, and we brought together a morning event fabulously with Dr. Josh Freitas, talking about brain health, Allen County Public Library, speaking of the services that ACPL provides, both libraries at home as well as through the Genealogy Center. And if there was one message that really resonated with me, is listening to the needs of the community is a desire of ACPL, whether that be within Fort Wayne, Indiana, Northern Indiana, or anywhere in the United States or Canada, that they wish to be a resource for y'all. So this afternoon, it's my pleasure to introduce Dr. Charlotte Yeh, and then I'll come on for a couple of minutes. So Charlotte and I had an interesting first meeting, and we were on a podcast. Actually, we're on the tech chat for a podcast, and she had this large fish behind her, and it is the largest fish, called whale shark. And I said, nice whale shark. And we came back on for the actual event, and she said, I checked out who you are. You fix underwater pictures. Well, of course, the conversation was having to do with aging and the things that we do as Vivid-Pix. But it created a night, and there's the whale shark. So it created a wonderful connection that I value. So Dr. Charlotte Yeh is someone who I'm proud to call my friend, and also someone I'm proud to call my colleague in trying to help the aging community and society. So I'll let her introduce herself. But Charlotte, thank you so much for joining us today.
Thank you so much. I have to say, I am just thrilled and honored and privileged to be here today, and so appreciate the opportunity. So I'm currently a consultant helping a lot of innovation startup companies help develop technology solutions to help us age independently in our home, in the community, wherever we choose to be, to the best point that we can. And prior to that, I was chief medical officer at AARP for nearly 17 years. And my earliest beginnings were as an emergency physician for 20 plus years, where to me, it is the incredible barometer of what works and doesn't work in healthcare in the community. Then went upstream to work for a Medicare payment contractor to understand how healthcare payments work, and then worked for CMS, Centers for Medicare and Medicaid Services, that administer the Medicare and Medicaid programs across the country. And from there, as I said, went to ARP as an advocate. So I like to say I've seen the world from all sides as a provider, a payer, a regulator, an advocate. And now what I'd like to do is pulling all these dots together to say, if we are going to change and improve how we age, we really have to understand where we are today, who we are, and where the opportunities sit for us. So I like to say, it's not that we're all about aging and declining, but it's really about the power that comes with age. So with the next slide. So it's really important to me that we have to start with, what are your understandings about aging? And I am sure when we talk about age, you're starting to think of things like, oh, gray hair. I need a cane. I'm slowing down. I can't move. I'm stuck in the home. I've got wrinkles. I can't hear, right? Well, I just want to say, I'm not so sure that that's the universal experience for what the aging is. So next slide. And in fact, shouldn't we be thinking about aging? Because we are growing the population more than ever. Some 20, 16, 17% of the population right now in the US is 65 and older. It's 28% elsewhere in the world, like Japan, or 22% in Greece. So instead of like going, oh my, we've got such a problem to solve, what if we changed it and said, look at how aging could be a remarkable opportunity to bring us together in this society? Next. And in fact, I love pulling up this slide. Here's Matt Damon. It was in the movie The Martian. And what you may not be aware of is there is so much science going on in and research and digging into what causes aging, how do we age, how do we improve aging, longevity research, right down to from genetics to molecular biology to potential interventions. And there's one study out there that proposes if we could increase our age span by 1 year, we could actually save up to $38 trillion just by slowing down all of the conditions that we typically associate with aging. So it's really a mindset. And maybe what we really do is to just science the heck out of this and see what we can learn and how to help all of us do better as we age. Next slide. So the first thing is, why is this important? It's important because it is the fastest growing population. At the turn of the century, our lifespan was around 40s, in the 40s, 47 or so. When Medicare was passed in 1965, the average lifespan was 67. We are now in a era where our average lifespan is in the 80s, high 70s and 80s. So it has continued to grow. And in fact, the 65 and older are growing 5 times faster than the rest of the US population. Next slide. In fact, how many of you knew that 85 and older is the fastest growing population in the US? 100 and older is the second fastest growing population. And my favorite number, and this was put out by the US Department of Labor and Statistics, is there's only one age band in the workforce that is going to be growing between now and 2030. And guess what? It's not the 18 to 39. It's not the 40 to 64. It's not the 65 to 75. It is actually 75 and older is the only working age segment that is growing between now and 2030 at a remarkable nearly 12%. All the other age bands are remaining static or even declining. So it makes me want to say to all of you, maybe we should be thinking about our 100-year lifespan because it is possible. And in fact, we should be thinking about how do we work productively, enjoyably, happily from now to age 75. Part of it, maybe we didn't have the financial security and resources and need to work. But there's also those who say, well, if I retire at 65, what am I doing for the rest of my life in order to enjoy and keep living well? So think about as you listen to our talk today, how might you envision a 100-year-old life? Next slide. So I know, and if you look at this slide, and this was done a few years ago, but it still holds true. When you think about aging, all you can think about is, oh, I can't do this, I can't do that, I can't walk, I can't, I have all these limitations, I won't be able to work, it's going to be hard to, do the grocery shopping, hard to vacuum. And in fact, that's not inevitably true. So sure, in your 90s, 90% of the population says, I don't have any health-related limitations for work or for housework. How many of you expected that for 85 and older, over half, 56%, say, I don't have any health related limitations with work or housework? This doesn't mean we don't have challenges, but it's also remarkable how many of us are still able to be productive and active in life. Next slide. And I'm sure we all have been hearing the mental health challenges, which are truly, truly, really real. And we need to have more support for our mental health. But what's also interesting is as we age, we actually have less prevalence of anxiety, depression. Somehow, as you get older, we reach this point of saying, I am who I am. You'll just have to put up with me. And I've had so many life experiences that, little things are little, and I can focus on the things that really matter. So, next slide. And even with the pandemic where everybody's stress and anxiety went up, as you age, the rate of increase of anxiety and depression really hit the young, and as you got older, it was less prevalent. Next slide. So it's a way of saying we're not only living longer, we're living better. And our attitudes have been changing over time. So, for example, in the past, when you think of retirement, we used to think of, oh, you're just riding off into the sunset, just sliding off, and it's all about rest and relaxation. Well, in the past, about 44% of the population thought that. Nowadays, it's only 27%, and over half, 55%, see retirement as an opportunity for change, a new opportunity. And in fact, um, most older adults are actually somewhat optimistic. If you don't have any chronic health conditions, over three-quarters are really optimistic about their future. Even if you do have chronic health conditions, over half are still somewhat optimistic about their future. And that's pretty comparable when I said, do you have limitations on health, from your health to work or to do housework? And in fact, in ARP studies, again, over half of people say their health is good to very good to excellent. Next slide. Okay, well, if it's not how long you live and it's not how well you live, let's think about the economics that come with, oops, back one slide, please. Let's think about the economics. Um, So the 50 and older actually contribute $8.3 trillion to the GDP in terms of their productivity, their work, their taxes paid, et cetera. And in fact, that would be the third largest economy behind the US and China. Moreover, if you are an entrepreneur in innovation, and as I said, I work with a lot of young, innovative companies that over half of them, or about half, are 45 and older. And if you're an older entrepreneur, you are 1.8% more likely to be successful. And you might say, why is that? Because we forget that as you age, sure, your reflexes might not be as fast, you might not be as quick, you may not be able to multitask in the same way that you used to, but over the years, we do gain assets like wisdom, like better um, um, emotional stability, better pattern recognition, better problem solving, better vocabulary. In short, you can get wiser as you age. That can compensate for the freshness and speed that you get, from youth. And wouldn't it be great if we could really encourage the multi-generational partnerships, et cetera, so we can take advantage of the assets across the ages? And by the way, we think of older adults not necessarily using technology, but right now the 50 and older spend over $120 billion annually on new tech purchases. In fact, the 50 and older are responsible for 56 cents out of every consumer dollar that is spent. If you look at charitable contributions, that's about $600 billion, well, 745 billion, of which 600 billion is through caring and caregiving and caring for others. More on that later. But we do $140 billion worth of volunteerism and $97 billion towards charitable contribution. And my favorite number is we spend $179 billion on our grandchildren. So we should be thinking as you age, you're living longer, you can live better, and you're actually part of the economic engine for the country. Next slide. When you ask about technology, it turns out that almost 100%, almost everybody owns at least one primary tech device. And in fact, the 70 and older, about 70% of them actually own a smartphone. And whereas it's about 90% of all 50 plus, and this is like smartphones and tablets and computers. The only area where the 18 to 49 actually have more technology than than older adults is probably in the wearable space. Um, and the use of technology for older adults is very similar to younger adults. You use it for banking, you use it for shopping, you use it for searching, you stay connected with family and friends. Very same and similar rates to the younger adults. The sad part is our imagery and how we talk about aging just has not caught up to how we're actually living. So if all these older adults are using technology, only about 5% are ever showing up in media imagery. So we are still trailing behind in our attitudes and thinking about what aging can be. Now, it is improving. There's more and more media and advertising that are starting to show older adults a little more active, but not nearly where we should be. Next slide. And in fact, if you ask, yes, the older adults are not as digitally native. And if you really wanted to get them engaged in technology and using it more, we have to recognize that we have to improve that user experience. Almost 2/3 of people 50 and older just do not believe that technology was designed with them in mind. They're not thinking about the font size, the light, the contrast, the hearing, the mobility. If you're doing touch technology, how you deal with tremors or drier skin. So it doesn't mean we don't age with issues, but the point is we could be designing technology to actually make it feasible, usable, no matter what your age, with simplicity and plug and play opportunities. Next slide. So as I said, we have not caught up in society with how we view older adults. In fact, it's really sad that 80% of older adults say they've experienced aging or ageism at one point, at some point in their everyday lives. And what is particularly sad to me is if you take a third of older adults who actually are watching media and watch TV and media say more than 4 hours a day, these are the people that start to internalizing and begin to think that being lonely or depressed is actually inherent to growing older, which it's not. So I think we have to be very cognizant on how we speak about aging, how we talk about aging, how we showcase people who are older across the ranges of capabilities that we have. Um, because honestly, I don't know anybody, and anybody who's listening right now who isn't older now than when this talk started. It is something that affects each and every one of us. Next slide. And you would say, okay, well, in the clinical world, because I'm a clinician, I'm an emergency physician, I'm a doctor, and I'm sure we all think, but in healthcare, oh, they're really, really good. They understand older adults. Well, in fact, that same bias actually can permeate in healthcare as well. This is a study that came out of the United Kingdom in the UK, where they actually have designated health apps that you can prescribe to patients. If you're under 35, providers are pretty common. They will prescribe to 1 in 10 patients digital health apps. But if you're 55 and older, it drops to 1 in 25. And if you're 65 and older, it drops to 1 in 50 because they are sure that older adults don't know how to use technology. And in fact, on the flip side, through that same study, if you actually polled the 65 and older, some 80-90% of them say, we would love to try digital technology. And if you actually look at procedures, whether it's dialysis, whether it's surgery, whether it's use of ventilators, for every decade older you are, there's a drop in the percent of people who are put on ventilators, people who have surgery, and people who have dialysis. Now, some of that may be the right decision because of how somebody chooses and wants to live. But in many cases, that decision is made because there's a bias. Oh, you're old and you can't possibly want to have everything done for you. Um, and it can also affect your care. So I have a colleague of mine whose mother was legally blind. She lived independently in her own apartment. She was in her 80s. And one day she started saying, oh, there's somebody who's been in my room and they've stolen all of my pictures. And everyone's looking at her and going, oh, you've just gotten paranoid. You've just become a little old lady who's really confused. We better get you to the hospital. And the hospital, they couldn't find anything. They said, well, maybe you've got a urinary tract infection, but you really are paranoid. You're delusional. So they started her on medications. And while they were in the hospital, the sister, or not the daughter came in and said, oh, wait a minute. She lives in this apartment in New York City, and next to her apartment, they were starting to do some construction. It was going to be noisy, banging on the walls, etc. And her mother had all these wonderful family pictures hanging above her bed. So her daughter thought, I'm going to take down these pictures so that they don't accidentally fall on my mom if she's ever taking a nap, during the day. Well, if you're 80 some years old, you go to sleep, you wake up, and all your pictures are missing. Aren't you going to say, who's been in my room stealing everything in my house? Right? So it turns out it really wasn't paranoid. It wasn't delusion. She ended up being discharged from the hospital. However, they forgot to take her off her medication. And then several weeks later, she had low blood pressure, etc., that came from the medication that she didn't eat in the first place because they just assumed she was old. So I just want to say we should be rethinking and really looking at who someone is, where they are, and not just assumptions. So, for example, next slide. I just wanted to show this is my dad. On the far left, that is my dad at 90. He is at his grandnephew's wedding and is dancing up a storm, and people were clearing the floor as he's dancing there with my niece. Soon after that, he started taking tap dance classes. And I just want to say at 97, he started salsa dancing classes. He's a little slower than everybody else, but he's learned a few new dance steps just in the last few weeks. In the middle is my dad, also in his early 90s at this point. My mother was diagnosed with cancer, and my dad, who never really formally exercised, said, oh my God, if she gets weak, I'm going to have to be able to help her. I better start exercising. So he started exercising, resilience bands, etc., because he knew he wanted to be able to help her if she ever needed help getting out of bed. And there he is exercising. And I have to say, in those next several years, he had such great muscles, better than I did from that. And then the third slide in there is he's now in his mid-90s. And at this point, my mother had passed away from cancer. My dad has profound, profound hearing loss, couldn't hear. So he has a cochlear implant and a hearing aid, as you can see. And she was his primary communicator. Well, with her gone, he had more difficulty in communicating with people because he had become dependent on her. So here he is in his 90s. We got him an iPhone that had speech to text captioning, and he learned to use it. And he uses it routinely when he wants to follow a conversation. He uses it for FaceTime. He uses it for family Zooms, connection calls, etc. And then what we did is we got an additional tablet that had speech to text captioning on the tablet, which is a free app. And anytime he went in to see a physician, we said, if you want to talk to my dad, this supplements his hearing. If you use the speech to text tablet with the free app, he will pay attention. And it was fascinating when he was recently hospitalized. By the way, my dad was first hospitalized at age 19. His next hospitalization was age 95. And at the age of 95, he was diagnosed with 2 different cancers, both of which are treated and cured, one of which was surgery. He's had 2 surgeries since then. And he is now 97. And as I said, he's taken up salsa classes. Okay. So you do want to reimagine what aging could be. In any event, he got this tablet, and I knew if he went into the hospital, the doctors would look at him and say, oh my God, he's just old, he's frail, he's not going to be doing anything. So we brought in the tablet. We showed pictures of my dad at home, dancing, independent, etc. We said, this is what he wants to be like. And we said, if you want to talk to him, use the tablet because you can use that to communicate. Well, the first time the doctors and nurses and the technicians said, the second time they came in and said, where is that device? I want to talk to your dad because it was quicker and easier. My dad could follow, he could hear and read the conversation. And then the third time they came in, I want this for my mom, my dad, my sister, my brother. They all have difficulties with hearing. Where do you get this? And I go, it's a technology and a free app. It's an iPad or a tablet. And then there were clinicians who came in and said, we heard you have this really great technology that allows us to communicate well with our patients. And I said, it's an iPad, it's a tablet with a free app. But the best part, and this really shows you how profoundly we can ignore and devalue aging. My dad actually turned to me during the hospitalization and said, do you know, for the first time, they're talking to me and not to you. And so he was now part of the conversation, part of the kind of care that he wanted to have. And lately, we have now migrated. He now has a pair of glasses. They're actually VR, but they're a pair of glasses where the speech to text is embedded right in the lenses. So he can look at somebody and actually read as well as hear what they're saying. So just want to say, we have incredible innovations in technology to help us age, but getting older is not inevitably with only decline, but how can you optimize how you live no matter your age? Next slide. So what I like to say is, what's it going to take to help us begin to change and really help influence so we can live longer, healthier in the way that we want to? Well, we know there's the healthcare system, and I've described a lot of maybe the not so good, but in fact, healthcare has been phenomenal in medications, procedures, treatments, advice on how to live a healthier life and live the way you want to. But there's so much disruption, et cetera, that we are still trying to fix and control. And then we've also learned what we call the social determinants, which is transportation, your education, your housing, meals and meal deliveries, food insecurity, that are also very influential for how well you can age and how good your health is. I'd like to say we've been missing a third lever, which I call the personal determinants of health. While we're waiting for healthcare to fix itself, while we're waiting for all the community services to get amped up, ramped up, and it's harder than ever, these days, um, why are we not also looking at the person, and can we improve their skill sets to care for themselves, their skill sets to stay as healthy as they can, their skill sets to stay engaged with their family, with their community? And I call those the personal determinants of health. And how prevalent is that? So next slide. Now, this is a study when I was working at ARP and with the Medicare plan for ARP. And this was a study where we just took a look at what was the prevalence rate of medical conditions. Those are the dark bars, like stroke, like heart failure, like cardiovascular disease, diabetes, et cetera, cancer. Um, and then what is the prevalence of things that are, like I said, the social determinants? What's not on here is transportation. About 19% of people said they had transportation difficulties. But how is your social network, which is part of your social and community. And those are in the light pink bars. The red bars are what I call the personal determinants, which is low purpose in life, loneliness, a negative view of aging, fear of falling. It's not the falls, but you're afraid to fall. All of those, what I call personal things that are your skill sets or your attitudes to how you live, are actually more common than things like obesity, diabetes, heart attacks, heart failure, et cetera, that we spend so much of our time on. Um, so I'm just saying, we should be really thinking about the whole person. What about your access to healthcare? What about the social support services, your access to libraries, access to other services, transportation? But we should also be thinking, how do we keep somebody thriving and living well? Next slide. So I call this the power of resiliency. We know if you teach resiliency to children, over time, they have better education, they have better income, they have better problem solving, they are able to thrive later. So shouldn't we be looking at resiliency across the lifespan? Next slide. And one of the things we did, and again, this is just a cross-sectional, it may look a little busy, but we looked at 5 different protective factors. Resilience, having a sense of purpose, being optimistic, how strong is your social connection and your locus of control? How much do you believe that you can control your experience in life? And it turns out, and if you looked at and asked about perceived anxiety, perceived depression, whether your health status is fair or poor, or how functional you are, it turns out for every one of those protective factors I just mentioned, and it doesn't matter which one, for every one you add, you had lower depression, lower anxiety, better health status, less functional limitation. Next slide. And if it's not just living that matters, in the next slide, it's also money. It turns out for every protective factor you add, you can lower your healthcare costs by $1,356 per person. Now, these are associations. I can't say they're causal, so I don't want you to think these are perfect science. But aren't these wonderful opportunities to say how, if we make a richer life as we age, make aging a more positive and valued part of our social and life experience, we might actually improve our health outcomes and we might actually lower our healthcare costs, that those opportunities could very well be there. Next slide. So I'm sure you're thinking, resiliency. I mean, how do we go about this? And I like to say, um, just because you didn't learn it in childhood doesn't mean it's too late to learn. If my dad could start exercising in his 90s and make a difference, surely our brain is remarkably elastic and plastic and can learn. And the more we learn, actually, that's one of the ways you can help mitigate cognitive decline, for example. So we looked at many, many factors. There are 20 some factors that go into resiliency or associated with resiliency. And we picked 3. I call them purpose, people, and possibilities. And you'll hear a little bit more about those because they're meaningful. There's evidence in the literature that they're modifiable. And 3, they are meaningful to people. So when we started looking at this, we said, everyone looks at the failure to thrive and how we can fix you. What if we looked at what was in the thrivers and what does that mean to your health and your attitude and your perception of living? So next slide. So let's talk about purpose. That is the meaning in everyday life. This is your why. Everybody's purpose can be different, but it is what gets you up in the morning. So next slide. It turns out that people who have a strong sense of purpose actually sleep better. They have fewer hospitalizations. They have fewer doctor visits. And there's some evidence that having a strong sense of purpose actually may help mitigate cognitive decline. And some of our preliminary data showed that sadly, about a third of older adults or 65 and older are low in purpose, and they end up costing us 12% more per member per month in healthcare costs. Next slide. What can you do about it? I mean, it's not a one-for-one correlation, but there are people who love to give back, who love to volunteer. Think about your librarians who are there helping people, volunteer or otherwise, and having meaning in life and how that can give them energy and joy in living. Well, it turns out if you volunteer approximately 100 hours per year, that's about 2 to 4 hours a week. Turns out you had a lower risk of mortality, improved physical functioning, better physical activity, and less depression, more optimism, and more contact with people. And in fact, and I think this is what's really interesting, we all know how important exercise is. f- Oh, next slide. And in fact, if you start putting numbers to this, we all know how important exercise is. So, one of my colleagues did a study looking at 61 different factors of risk factors for hospitalization. And it turns out, of course, if you do a lot of physical activity, you're 20% less likely or lower risk of hospitalization. But if you help friends or neighbors from 100 to 199 hours, that's 2 to 4 hours per week, you have a 27% lower risk of hospitalization. So having that sense of purpose and volunteering are just some examples of purpose. And everybody's purpose can be different. It could be my purpose in life is to have chocolate ice cream every single day. Other people's purpose is I'm going to fix climate change and anything in between. Next slide. The second is P for people. And and we've all heard about this, and sadly, we had to experience this through the COVID epidemic, loneliness. Next slide. And I'm sure you know now that for those who are severely lonely, it can lower your longevity by 8 years. It's about half a pack of cigarettes per day. We discovered and early on that loneliness had the largest negative effect on your quality of life, more than health literacy, more than depression was loneliness, and your mortality risk is greater than being obese if you're severely lonely. And it turns out that severely lonely costs us 20% more PMPM or per member per month. And that loneliness, by the way, is subjective. That means how you feel. Social isolation, which you may also hear, is an objective measure of your connection. So you could have many friends and be lonely. You could have no friends and not be lonely. So they're two separate constructs. So if you're lonely, it can cost us more in healthcare costs. For the ARP also did a study looking at social isolation, that objective measure of how big is your network. And those with social isolation could potentially be costing us $6.7 billion in Medicare annually. And what I find interesting is we discovered this loneliness factor back in 2015, well before the pandemic. And everybody just sort of laughed at me and said, "What are you talking about?" Next slide. And now, we're all cognizant, we're all aware of it. We have learned, and this is from the Surgeon General's report, but we have learned in the Gallup poll for happiness that the single biggest factor or contributor to happiness is your social connection. And the Harvard study that has been studying, that's now been going on, I don't know, 50, 60, 70 years. It started when in the 1930s, so actually nearly 100 years. It started in the 1930s with 18-year-olds, men only. They didn't study women back then, and have followed them over time. And those who have lived the longest, who've had the most productive lives, the single underlying factor has been having a good partner in life or friends and family. It's your social connections that matter. Next slide. Doesn't mean you have to be married. It just means you have to have friends and social connection. So I'd like to just take a little sidebar here and talk about one of the most common factors for loneliness, for social isolation that is out there, that's a huge silent epidemic that we never talk about, and yet is so common as we age, and that is hearing loss. Helen Keller, who was both blind and deaf, and I know we all think of blindness as being, oh my God, that's the worst thing that could ever happen to me. And yet, if you asked Helen Keller, blindness separates people from things, but deafness separates people from people because you lose that communication and touch. Next slide. And why does hearing loss matter? And by the way, it is currently not, hearing aids are not a covered service in Medicare because in 1965, when Medicare was passed, this is the impact of ageism. When Medicare was passed, hearing loss was considered normal aging and not an illness or an injury or a condition to treat. So therefore, hearing aids were statutorily excluded from the Medicare law. And so that's why it is been such a tough area to both get access and find affordable hearing aids, but we'll talk about that a little more. But how big is this number? More than 2/3 of adults 70 and older have clinically significant hearing loss. About 40% of people 60 and older do. And again, we studied that hearing loss had a greater negative impact on your quality of life than diabetes, than stroke, than cancer. And if you look at the cost of care, it's about $133 billion in healthcare costs for those with disabling hearing loss, and about $1 trillion in lost productivity when you look at the workforce. Next slide. And more recently, it has now been identified that hearing loss is the single largest category of a modifiable risk factor for dementia. So what do I mean by that? The Lancet Commission on Dementia identified that about 40% of dementia is potentially modifiable. So the risk, and there are risk factors, many of them, things that you're aware of, like obesity, diabetes, hypertension, social connection, as we just talked about, depression, head trauma, alcohol, etc., are all contributors to some aspect of cognitive decline. Hearing loss is the single biggest risk factor. And back when they had about 20 of these risk factors, hearing loss represented about 8%. Now they've identified even more modifiable risk factors, but hearing loss is still in the top category of modifiable lifestyle for dementia. Next slide. And what's particularly exciting is last year we came out with, or last year there was the study that came out, which was a randomized controlled trial of older adults with hearing loss, with and without a hearing aid. And it turns out for that subcategory of people who are at risk for cognitive decline, who got a hearing aid with hearing loss, they mitigated or slowed down their rate of cognitive decline by almost 48% over a 3-year period. And yet we never talk about hearing aids. And I like to say, if you think about hearing aids, most people say, oh, as soon as I get hearing aids, I'm old. I'd like to say, you're old without hearing aids. Next slide. This was another study that we did while I was at ARP in conjunction with Johns Hopkins Hearing Center, and looking at over 100,000 claims, medical claims in Medicare and commercial population. And we looked at 2, 5, and 10 years of uncorrected hearing loss, like you didn't do anything about it. And for those, I'll give you, these are the 10-year results because people wait on average 7 to 10 years to do anything about their hearing loss. So if you go 10 years without doing anything, your risk of dementia, as I said, is higher. It's 52% higher. Your risk of depression is 41%, probably due to social connection and isolation, and poor communication. 29% higher risk of falls. And the impact on healthcare costs, 46% higher healthcare costs. That's $22,434 per person. Again, it's the association. When I tell you that over, 2/3 of people 70 and older have clinically significant hearing loss, and only about 30% ever get hearing aids, think about the cost of care that results from the declines when you can't hear. 47% more hospitalization, 44% more readmission rate, and in fact, a 2.5-day longer healthcare stay. Next slide. And it really matters because if you can't hear, you can't communicate, you're embarrassed, you don't talk to people, you misunderstand. It's one of the most common reasons for early retirement from the workforce. Remember I said, how many people are working to 75 and older? Well, some people leave early because of hearing loss and they're not communicating and they misinterpret and then it's viewed as poor performance. But it has a medical impact because if you can't communicate, you're less likely to obtain medical care. You're less likely to fill prescriptions. And if you have a lot of trouble, it's really significant. 85% less likely to get medical care um, and 56% less likely to fill your prescriptions. And this was something I found with my dad with his hearing loss. Um, and that's why all of us have been so engaged in helping him communicate so he knows how to care for himself, what medications to take. This doesn't mean you don't get chronic illnesses as you age, but how you manage them can make a big difference. Next slide. And it affects your social connection. If you self-report poor hearing, you have a 50% greater risk of loneliness. For every 25 decibels of hearing loss, you have a 2 times higher risk of social isolation. And if you have hearing loss, you then become more dependent, like my dad, on caregiving. So my suggestion to you, and especially with technology, get your hearing tested. It's really easy. You can do it online. There's an ARP website. If you're an ARP member, you can get a free hearing test. You can now do it on your phone. You can do it. There's a Johns Hopkins app that you can get what's called your hearing number that can help rate you whether you have mild, moderate, or hearing loss. And because it declines over time, you can watch the decline to figure out when you might want to do something about it. And there's other free apps that are on phones and on the computer. And frankly, you can do a hearing test. I don't like to give products, but with AirPods, with Apple, that has really broken open the world and ease of identifying and managing hearing loss and also protecting your hearing. And I love the fact, not love the fact, but I think it's really remarkable that 30%, over 30% in an ARP study of millennials and Gen Xers are already having difficulty hearing in noisy environments. And that's one of the first signs of early hearing loss. You're fine if it's quiet, but you go into a restaurant or you go into a noisy environment and they're all wearing ear pods with increased sound, not protecting their hearing. And so I worry that we're going to have a generationally more hearing loss that we'll be coping with if we don't do something about it. Next slide. And finally, as I said, people think of hearing loss, use of captioning. Oh my God, that means you're really old. Well, about 80% of people who use captioning are not hard of hearing. More people are likely to use that when they're watching videos on Netflix. And literally this morning on the news, I heard that the largest category of people who use captioning are actually younger adults because they love multitasking. So it's not that you're old, you're just not part of the modern generation. Next slide. So the third item that I want to talk about is optimism and a positive view of aging. Next slide. So it turns out if you have a positive view of aging, you are more likely to recover from a disability. There's one study that took a look at starting with 70-year-olds with no problems, followed them for 10 years. And of course, everybody had a problem or a disability. If you started out with a positive view of aging, you were more likely to fully recover. An 80% reduction in cardiovascular risk. You can live 7.5 years longer. And 40%, but it's so prevalent that 40% of us have a negative view of aging, costing us 33% more per member per month, or in one study, $63 billion due to ageism in our healthcare system, as I mentioned. Next slide. And compared to people with the lowest negative perception of aging, those who had a high view of aging actually had a lower rate of hospitalization as well. Next slide. And these negative perceptions have a real impact. Next slide. It turns out that it is in the media, it's in our advertising, that we're 7 times more likely to be portrayed negatively. In the first study that was done of this a few years ago, only 15% actually even showed people, older adults, although 46% of the population are 50 and older. And if they showed you, you were more likely to be seen alone, getting help and being dependent on someone, or you were, classically dancing, with a partner in your house. Just it really not showing how we truly engage in the community. And only 4% showed the 50 and older with coworkers and in the workforce and active in the community. Next slide. And so that negative view of aging is so strong around us that I think it behooves us, and you'll hear more of some examples of how we can begin to change that perception. Um, and then lastly, as we age, we know that we need caregivers. Next slide. And as I said, unpaid caregivers spend $600 billion of unpaid care services. It creates a lot of stress. They spend on average out of pocket over $7,000. It taps into their savings. It taps into um, um, their reserves or what they spend money on. So this is a place, and it used to be when ARP was studying, the number of caregivers, it was around 44, 45 million. Now it's 54 million. Or 1 in 4 adults are caring for somebody over the age of 18. So it matters. Next slide. And that's a whole talk in and of itself. So in short, I want to say, let's think about age as an equity issue, that we shouldn't be designing for old. We should be designing for all, like captioning. And why is it, if we're going to design for old, that we're not bringing joy and happiness? Who says you can't laugh if you're 85 years old? Where's the beauty? What about fashion? I love that there's a modeling agency in Singapore that you have to be 50 and older before you can even apply to that agency. And we should be thinking about connection and showing that there's value, that you are valuable as you age to your community. Next slide. And our next generation, we all talk about being independent in the home. I'd like to say we learned in the pandemic, if you're at home, you're not a happy camper. We can design everything to have everything you need in the home, but we're not a happy camper. So what we really want to be thinking about in the next generation is not just independence in the home, but independence on the go, so you can stay connected to the community to the degree that you want to. Next slide. And there are so many products out there that are looking at accessibility. Now, not all of them, they're still in prototype. Not all of them, have succeeded, but there's people working on clothing that gives you a little power boost as you walk on your knees or on your body. I mentioned the captioning glasses that we got from my dad. That bottom corner, when have we last redesigned walkers? I love this one in the bottom corner. That is a walker designed by an older woman who lived in Maine, who loved to go on hikes. And the standard walker with the tennis balls just didn't cut it. So she and her husband took bicycle wheels, redesigned a walker so she can now go out on the mountains of Maine on the hiking trails. And she can have joy, she can have beauty, and she has connection because she's with her husband. There are shirts out there that you can feel the sounds of the drums, of the drums, the violins on different parts of your body. And now, prosthetic legs are just a work of art. So we should be thinking about, how do we make things accessible? And even if you're challenged, it can still be beautiful, fun, and joyful. Next slide. Is, from Rick, the fact that you've got Vivid-Pix, that you can take old memories, restore them, whether it's videos, whether it's photographs, whether it's mementos. And it is a wonderful way to connect with your family, with your past, with your history. And for those who do end up having cognitive decline and starting to have decline, it is a great way to trigger and remember and actually help with the care and management. If they see someone eating, they're more likely to eat, and it can make a difference. So There are incredible tools like Vivid-Pix. There are other companies out there that are starting to say if you forget a word, that it can prompt you with the next word that you are thinking of, that you want to say. So keep an eye on the innovation that's coming. Next slide. And the innovation that's here. You can have animatronic dogs and cats that there have been tens of thousands of them sold all over the country and distributed by state aging departments for lonely older adults. And games, game playing, go back to board games. So you can, these are games that were designed for older adults with bigger font, easier to use. The Trivial Pursuit is by generation. So you pick whether you're a Gen Z or man's greatest generation, and answer the trivial questions based on the generation that you have picked. So really great dialogue for families and communities. Next slide. ARP worked with Allure magazine, and you may have noticed that in Allure magazine, they have banned the word anti-aging, because why are we anti-aging since we all age? I love that Soul Pancake said, can we just stop saying you look good for your age? What if we just said you look good? These are things any of us can do. Next slide. And they're also now start looking for video content, photographic content that you may be using in anything you produce to actually show older adults the way we really are living today. Next slide. And age tech is really now growing to be its own marketplace for technology, for business, to help us begin to connect and help us handle the challenges that do come with aging. Next slide. And sometimes it's just words. So comes from the city of Boston, where I live. The city of Boston heard all of this and they said, you know, we have a Department of Elder Affairs or Commission for Elder Affairs. We're going to change our name to the Age Strong Commission, because it's not that you're the elder affairs, you're really about how do you age strong and what can our agency do. So they have these wonderful ads, and I love this one and these are real people living in Boston. My favorite is Irene, who's 103 years old, and she says, you think I'm out of touch? Whatever. I use a smartphone, paint every day, place I don't go, spend time with my boyfriend, and many things, and see now is not one of them. Imagine what we can do with words. You're sitting in the library. Imagine the opportunities that are just sitting around you. Next slide. So in closing, I like to say, it's really not about aging in place. Isn't it about thriving in motion? It's about those 3 Ps: purpose, what gets you up in the morning, people, who you do it with and who support you, then your possibilities, your hope, your optimism, your perception of aging just become endless. As I said, whether it's ice cream or social change or anything in between, isn't that what aging should be all about? So I'm sorry I went on quite a while, but I think we still have about 15 minutes for questions if anyone has any. Next slide. I mean, less itis, but we can leave this one up because it's really.
Oh, we want to look at you. So, do we have any questions well, first off, Charlotte, thank you. One of your lines is that, yes, we all are aging. So let's thrive as we age, because ultimately that's what we're all going to do. So thank you for being an inspiration to all of us to help us thrive as we age. Do we have any questions from the room?
So I can't see or hear the questions, so hopefully somebody will repeat them if there are any.
There's a person here, he's collecting what the question in his mind.
Yeah, it had to do with hearing.
Okay.
Especially about hearing, because I know I meet with a bunch of retirees and only 2 of us don't have hearing.
So
Good.
did you hear that?
Yes, I'm thrilled. So
Here's a play on word. Can you hear that?
no, I think that is terrific. So I do want to say, I know hearing aids can be quite challenging, because one, we think it makes us old. Now we learn, and everybody now puts things in their ears. So you shouldn't be different if you've got things in your ears. because people worry about the stigma. But I do know accessibility and affordability are really big. What is nice nowadays is with legislation, regulation, we now have on the market what are called over-the-counter hearing aids. They are much more affordable. They are more of a do-it-yourself. You can do your own hearing test. You can fit them yourselves. You can buy them online. Some hearing aid distributors also sell them. So, and now there are glasses that have hearing aids built into them. So there's nothing in your ear. It's just a pair of glasses that you can put on. They've been in the market since March, and they're particularly designed for hearing in noisy environments. So if you're at a restaurant, you put on the glasses, you can pay attention to the conversation. And then you, for the price of a lower cost hearing aid, you have hearing aids and glasses because you can get lenses, prescription lenses put into that. I mean, that is where some of the technology is going, but you have to remember that just getting a hearing aid doesn't mean when you put them on for the first time that your hearing is perfect, because your brain has lost the ability to convert sounds to hearing and speech. So you do want to start slowly and practice and begin to use it, and better to start early before you have any brain decline of the ability to convert sounds to hearing. But thanks for the question, and I'm so glad you all have hearing aids.
Yeah, another on that one. The fellow I'm talking about is 94 years old, and he has $7,000 hearing aids. And the feedback says when we go out for breakfast and we're in a large area, they feed back and they start squealing.
Oh,
And if I don't talk to him directly, face to face, so he can read what I'm saying, he has a hard time. Then he disassociates from everybody else at the meeting, because if he can't hear, he just sits there and stares.
yep. So a couple of things. Price isn't everything, so he may want to go back to the audiologist and just make sure that the hearing aids are for him. Number two, and it depends whether he's capable or not, but many of, look for the features, because some hearing aids, either on an app or on the hearing aid itself, you can change the direction of the mics and how it hears. So it focuses in front of you and you can amplify it for speech. That's what those hearing aid glasses do. You can focus in front. So therefore, it is best in conversations, in noisy like restaurants, or when you're with a group of friends where it's hard to follow. And the third thing, we do this for my dad, is we do the captioning in addition. So depending on his skills, tech, and capabilities. And by the way, yes, they are expensive. There are, again, you can get them online. You can try them on consumer retail stores. But the VA covers them, and many health insurance plans are now beginning to have some coverage for hearing aids as well. But you do need to retrain and work your brain to learn how to hear again.
Makes sense. Thank you for sharing.
Thank you.
One from the back, and then yes, please. Yes. Or from online.
How do you convince an older adult who says they hear fine, but they need hearing aids?
So Charlotte, the question from online is, how might you convince an older adult who says they hear fine, but people are observing that might not be the case? How might you guide someone?
Yes. So so it is really hard, because that stigma, and I've heard many people say, I know I have hearing loss, but the day I get hearing aids, I'm old. Otherwise, I'm just getting older. So we've got to dissuade them and say, hearing is really important for you to stay social, communicate, to hear your grandkids, or maybe think of events that you go to. We'd love to have you come to a restaurant or a party or a reception, but so you can understand and be part of the party. One of the more powerful drivers that have come up now is, asking how important their brain is, their cognitive function. And as I said, one of the things, if you get hearing aids early, even when you don't think your hearing is that bad, if you get it early, you can then begin to mitigate or to begin to slow down cognitive decline. It's a way to protect your brain. And so that has been one of the big motivators. So it's really about social connection. It's really about being with people where you don't have to worry that it has to be a quiet one-on-one conversation in your house, that you can actually get out and enjoy. Because and tell them it's really common. It is so common. 2/3 of people, older adults, have hearing loss, and it's already.
Maybe we just need to have an adult conversation.
Yeah.
Yeah, it's something you might need. And you'll enjoy it more.
Yeah. And I will say my dad, had progressive hearing loss for 10 years. He was so classic, didn't think he needed hearing aids until my mother got locked out of the house because he couldn't hear the doorbell. And so now, and he then, once he got hearing aids, he then admitted that he was really lonely. He was angry. I thought he had dementia because he wasn't responding and being engaged. And, so we reminded him, you love being with people and you're not. And I'm sure you're frustrated and angry. And you know what? It's a fixable thing. And if it doesn't work, you can always give it back.
Makes perfect sense. You had a question?
Yeah, I am quite intrigued by the Age Strong Commission in Boston. Are you affiliated with that, Dr. Yeh?
No,
I-
I'm not officially affiliated. It is actually the state agent or the city agency for elder affairs for connecting people to services for older adults. But they changed their name, and they're actually advertising it on buses and airports um, and I thought, isn't that it's how simple, just change your name.
Yeah, I am very excited about that, and I'm going to research it much further and bring it back to our agency because you are absolutely right. It's degrading, aging. That's the one like ism or I guess what am I trying to say? Like there's racism and all kinds of isms, but aging people actually become.
Yeah.
And yeah,
And it's a good thing.
yeah, yeah, it is. Get older, but discrimination. I apologize. We discriminate, but we become lucky. So
We absolutely do, and I feel like it's a unifying theme because every single one of us is older every single minute of every day, and I do not mean to be Pollyannish about this to say, yeah, 56% of people don't have health limitations, but that still means almost half do. So we have to understand it's all part of a continuum, but if we keep you engaged, if we keep you hearing, if we keep you with value and purpose, you will live better even with challenges. So I like to say, if you're stuck in a wheelchair, that doesn't mean you can't read to a 3-year-old and teach them to read, or a 6-year-old or an 8th grader and help them with reading, learn a new language. Even if you're you know, you know, it can help with your learning, and we know that if you learn new things, it will help with your cognitive cognitive decline. So even if you're stuck in the house, it doesn't mean you can't take online courses to learn a new language. There are now programs where you can travel with a real tour agent, on screen with others around the world. And even if your cognitive decline, one of my favorite stories is there's a company that does VR glasses that help you remember, just like Vivid-Pix helps you remember your past. And they put these VR glasses on a woman in a memory unit who hadn't sat or moved for months. They put these on her, and suddenly she stood up and started laughing. And what was in her field of vision? A entire field of puppies. And she started laughing and petting the puppies, the virtual puppies that were in there. So even if you have cognitive decline, it doesn't mean you can't thrive spiritually.
Wonderful. Another question here from online.
When it comes to reinventing the senior center as thriving emotion centers, how do you see them incorporating these aging aids into their programming opportunities?
So to paraphrase, as senior living locations reinvent themselves, how do you see them utilizing these new technologies within their operations?
Oh, so I think that's a great question. First of all, I've described a lot of things you probably didn't even know about. So wouldn't it be nice to have a tech day where people can come and play and, try out the hearing glasses, try out Vivid-Pix, to show how easy it is to, capture your memory, touch and experience. There are also companies out there that will do tech days, like Genius Bars in the senior center. So bring in your technology, we'll help you figure it out so you can become a little more tech literate, for example. You can do things like, the ageless innovation. I mentioned board games. They actually, they did this in the state of New York, where in the community centers, they brought in board games and brought in the high schools and, surrounding businesses and older adults from senior communities and living centers to come play board games, Trivial Pursuit, Life. I think they've got a few other games now. And they said people came in and started interacting. They didn't even want to stop playing the games. Some of the people came in with their canes and walkers. They stood up during the entire game, reaching across the table because they were so engaged. They forgot that they needed the cane or the walker. So think about those kind of, cross-generational fun. Where is the fun? Where is the storytelling? Where is the opportunity to make the connections that aren't, oh, you're lonely, I'm going to have to send you somebody to talk to, but where it becomes an engaging part of everyday experience.
So two things along those lines. I happen to love the Ageless Innovation product line. We Vivid-Pix own a company called Reunions Magazine, 35-year-old company on family, class, and military reunions. And we are using the Ageless Innovations games as giveaways to engage multi-generation at the family reunions, and people are just loving them. So love Ageless Innovation. Second thing that just came forward, Dr. Yeh, is where can y'all play with some of the new tech? There's a wonderful location 4 hours south of here that just reopened called the Thrive Center. And the Thrive Center was developed in order to be able to provide just that. So Thrive Center, Thrive Center KY.com, ThriveCenterKY.com. And at the Thrive Center, Sherry Rose and the local community, legislators, Bellarmine University, they have brought together a full showcase of various tech. NIH is there, NIA is there, CABI is there, which is the Canadian counterpart, as well as various technology. We happen to be one of them. So Thrive Center, KY, wonderful, wonderful place in Louisville.
Yeah, and so you can take and have sort of mini replications of that. And the other thing is, let me flip this. I mean, this is all saying, all right, I want to get older adults comfortable with technology, but how many of you actually reach out to local business and academic centers that may be around you to say, if you're testing out new technology that you're developing, why don't you come to our senior center and get some real-time feedback from the seniors, what they like, what they don't like. And the beautiful part about that is the older adults go, wow, they really valued my opinion. They wanted to know what I thought. And so I know there's a senior living center here in Boston where a robotics company came in ostensibly to say, would you like to have a robot in your apartment? And how would you like to use it? By the time they finished, 3 of the people who attended, older adults, actually became volunteer coders for the robotics company. So think about this kind of two-way opportunity and not just a one-way. Here's what we think you need. By the way, can I tap into what works for you and what should we design for you?
Well, and one of the things, Charlotte, that you have taught me through these years and being an entrepreneur, developing product for a market, many companies don't actually spend time with who their clients are. And we spent a lot of time with older adults to make sure they could use our stuff. So it's good business to spend time in those living activity locations to improve your product.
Yeah.
Another-
And I will say, I hear, because I sit on the other side working with a lot of innovative companies, and they are starting to ask me, hey, who can I talk to? Where can I take this to see and get feedback from people? So the more you're part of the co-design as a community center, A, you're engaging your seniors, B, you're helping better products come into the market.
Completely. Yes.
I watch a lot of Japanese TV, and the Japanese have developed in the aging and home services, a AI bot that's a small robot, and they use that to interact with a lot of their patients. And the robot learns from the patient. So the questions they're always asking, and the robot will interact constantly. Now, I was wondering if you've had any contact with those companies to use those robots that are small. I've seen them, and they're almost like a desktop.
Yeah. So there are a number of companies that are working in this space with a wide variety. One of them in the US, one of the more ones that is talked about is one called LEQ. So it's just a little AI learning little robot. Doesn't really look like a person, but it's sort of animated. And it will ask, how was your day? It will tell jokes if you want it, tell you what are the events for the day that are going on, remind you to exercise, take your pills. So there are those tools that are out there. You know, AI and generative AI is just exploding. So it's something we still are learning about how to use AI properly and correctly, and you know, and not end up with more hallucinations than actual pragmatic advice.
Amen to that. Charlotte, it's so good to see you.
Yeah.
Thank you so much for your time, your insights, and helping us thrive as we age. Thank you.
You're welcome. Thank you for having me, and I was just delighted to be here.